What if a silent disease was affecting nearly half the country, with links to heart failure and even cancer? The CDC reports that almost half of adults over 30 have some form of gum disease. It is a silent epidemic. The main reason it's so widespread is that in its early stages, it is often completely without pain, and its most common sign is something most of us have been conditioned to believe is perfectly normal. Here, we will expose the early signs you might be missing and give you a clear plan for what to do right now. Let's be perfectly clear. Healthy gums do not bleed. If you see pink in the sink, that is the first alarm bell. This stage, gingivitis, is your window of opportunity. The damage is often completely reversible right now, but if ignored, it advances to periodontitis, causing permanent damage to the bone that supports your teeth. It all starts with plaque, a sticky film of bacteria you can brush off. If it's missed, plaque hardens into tartar. And here is a critical fact. Once tartar forms, your toothbrush and floss are useless against it. Only a pro can remove it. Instinct tells you to avoid a bleeding area. That is the wrong move. It needs more gentle cleaning, not less. So why does plaque get out of control? Your diet is a huge factor. Sugar is a superfuel for harmful oral bacteria. But this isn't just about your teeth. The inflammation in your gums does not stay confined to your mouth. So where does it go? Medical research has proven a frightening connection. Chronic gum inflammation is linked to heart disease and stroke. The bacteria can enter your bloodstream, traveling through your body. Studies even link it to stomach and lung cancers. The connecting element is inflammation. The constant alert from your gums puts your whole body under low-grade stress. Since bleeding can be missed, what other clues are there? One unusual sign is a persistent metallic taste in your mouth. Look at your teeth. Are small new spaces developing between them? This can mean the underlying bone is being damaged. What about bad breath that never seems to go away, even after brushing? It is often caused by bacteria in gum pockets. Finally, check the color. Healthy gums are a pale pink. Bright red, dark red, or purplish gums are a classic sign of trouble. So, you have checked the signs. But what if you are doing everything right and still have problems? The causes are complex. Next, we will identify the hidden risk factors that can undermine even the best oral hygiene routine. Your own genetics can play a large role. Also, high stress levels weaken your immune system's ability to fight infection. Certain medications for blood pressure can affect your gums, as can hormonal shifts during pregnancy or menopause. This is why gingivitis is surprisingly common in adolescence. It is not just a disease for older people. Conditions like diabetes dramatically increase your risk. It's a two-way street, as gum disease can worsen blood sugar control. With all these factors, it can feel overwhelming, but you have more control than you think. Let's create an action plan. Remember how this all starts with a battle of bacteria. An unexpected weapon is probiotics, which work in your mouth too. Oral probiotics introduce beneficial bacteria that crowd out the harmful types, reducing inflammation at the source. Simple home remedies can also soothe inflammation. Saltwater rinses and oil pulling with coconut oil can be effective. But remember the rule about tartar. Home care only manages plaque. It cannot remove hardened tartar. That's the line. When is it time to see a professional? The signs are clear: persistent bleeding, constant bad breath, or loose teeth. A professional cleaning is the only way to remove tartar below the gum line. Your dentist might suggest cleanings every 3-4 months. We have seen that gum disease is common, silent, and affects your entire body. We've shown you the signs and the solutions. Taking control of your gum health is one of the most powerful actions you can take for your overall well-being. Don't ignore it.